Okay, start.
Good evening, Noora.
Good evening, doctor.
Yeah, I believe you know me, right? I'm Dr. Sridevi. I'm the
Yes, doctor.
pediatrician here.
We do the rounds daily. Yes, doctor, I know you.
Yeah, nice to meet you, Noora. And how is your rotation going on, Noora?
It's nice, doctor. I'm feeling very happy in the unit and I see so many cases and I'm learning as well.
Yeah, that's great. Yeah, I have seen you are very keen student and always you try to learn many new things about the new cases. Yeah.
Thank you, doctor.
Okay, so Noora, I believe you want to discuss something about the Hina, right?
Yes, doctor. Yesterday we saw this patient, Hina. She came to us with 14 tablets of paracetamol ingestion. I was shocked to hear this. How she ingested so many. Now, how she will come out of this problem. That's why I am here to discuss with you.
Okay, okay. So we will go through this case. So before that, do you want anyone to attend our meeting, your friends or somebody?
No, doctor, all are busy.
Okay. So Noora, can you tell me what do you know about this paracetamol poisoning?
I know that it will affect the liver. Paracetamol in excess quantities will affect the liver. So we shouldn't take it overdose. But I don't know the levels. How much is the level of it? Like, what is the calculation of the level to call it as overdose?
Okay. So yeah. So actually, the paracetamol poisoning is when it is according to the body weight. We have to calculate. If it is more than 200 milligram per kg,
Hmm.
okay, if the ingestion is more than 200, then we have to think of paracetamol poisoning. Am I
Okay.
clear so far?
Yes, doctor. Uh,
Yeah.
Actually, her weight was 40 kg and we calculated.
Mm-hmm.
And it was 175 mg per kg. Still no need to do anything for her.
No, we can do it. Actually, this is what like 200 is taken up, but even some people they take it as 150 mg per kg. Okay.
Oh, okay, doctor.
Yeah. So what happens is it's like no when the child comes, it's really difficult to find out immediately in these cases that how much they have taken and what is the blood level. Okay. So do you have any idea about when to do the blood level for these cases?
Yes, doctor. I went back and studied. It's given 4 hours, but I did not understand. We just doing without doing anything to the patient. We just wait 4 hours before starting N-acetylcysteine for the patient. I feel we are delaying the treatment. Why it is given the
Yeah,
4 hours? We have to
yeah,
check.
yes, yes. You have very good idea, Nora. Exactly what you said. At 4 hours they do, and what happens is it's not like we don't do anything. Once the child presents, even if it is not 4 hours, we have to start the treatment. But we'll do the blood levels at the 4 hours.
Oh, then you will give N-acetylcysteine even before 4 hours for all children with paracetamol poisoning.
Usually, suppose they presented within 4 hours, what we can do is we can try with the this activated charcoal.
Oh,
Okay,
okay. Okay.
okay, so that it will, how it works.
Yeah, I know that it will reduce the absorption of this drug, but I don't know
Yeah,
how exactly it works.
yes, yes, very good. Yeah, that is how it works. Okay, this
Okay.
activated charcoal. And then what happens is, and if the child comes after 4 hours, okay, so we don't have time to wait for the report, right? So in that case, we will start immediately N-acetylcysteine.
Okay, that's what was done for Hina. She was started immediately with N-acetylcysteine. Uh,
Yes, we will send the sample for this blood level and we'll start N-acetylcysteine.
okay, doctor, can you tell me about this stages of this paracetamol poisoning?
Yeah, actually, when they come, initially they present with all GI symptoms. Okay,
Okay.
so
Okay.
initial stage. So, do you have any idea like what symptoms they can have?
Actually, I have no idea, but I saw in the patient, she was vomiting. She had sensation of nausea and vomiting. That's what I saw.
Yes, yes, exactly. That is what happens. Okay, so they present like as if having gastritis, okay, with nausea, vomiting, tummy pain.
Okay.
Okay, and then later develops, they can have even like no right upper abdominal pain.
Okay,
Okay,
doctor.
yeah,
Okay.
and later it will affect. Do you know what is the effect? Usually, which organ is affected more in these
Yeah, liver,
cases?
liver, liver.
Yes, yes, you are right. Okay, so it is liver which is affected. So that is why, for this reason, we do the initial investigation, the blood levels and the liver functions.
Oh, okay, doctor. What else you
Okay.
will do apart from liver functions?
Yeah. Other than that, we need to check the blood sugars. Okay. Okay.
Okay.
And then urea electrolyte levels also we
6
need to
minutes
do.
finished, 3 minutes left.
Yeah.
Okay.
Okay. So do you have any idea any other organs which can be affected?
No, no, doctor, I don't know.
So sometimes there can be renal involvement. Okay.
Okay, okay.
Okay, so for this we will do like this treatment.
Uh,
And yeah,
okay.
any other thing
Yeah.
you want to ask?
Yeah, doctor, I want to ask why this paracetamol we see every now and then we give to babies and they are fine. Why in overdose it is causing such an effect on liver? What is the, can you tell me why it causes
See,
like this?
yeah, there is a therapeutic level. Okay, what happens is any drug, if it is underdose or overdose means it won't work, and overdose means it will cause like it acts like a poisoning.
Okay. Yeah, I
Okay,
want to know
uh,
some toxic I just
yeah.
going through, but I don't remember. Some
Mm-hmm.
toxic agent is released, which is the reason for liver injury. Can you tell me about it?
Uh, yeah. Actually, I'm sorry. I will go through it and come back to you. I don't remember exactly about
Oh,
the. Okay,
okay,
that.
doctor, no
Yeah.
problem.
Okay.
Then
Then
you know why this N-acetylcysteine is given? Do you know like how it will help in this case?
this N-acetylcysteine. Sorry, no, I exactly don't know how it works. But mainly it helps in the reducing this toxic, like you told, no, the
Okay.
toxic material which is formed. Yeah.
Okay, doctor. I want to know one
Okay.
more thing.
Yeah.
This diagram you have drawn, can you tell me about it, how it will help in these patients?
Yeah. Usually the levels
Hello?
will fall.
Yeah, you can, I can see the diagram. Explain if you can.
Yes. Yeah.
Okay.
Okay. So this is the level, highest level, blood level you will see at the 4 hours, and it gradually falls at 24 hours. Like
Okay.
no, slowly. Okay, so in these cases, do you have any idea about the treatment of this? Like other than this, what we can do for this child?
Yeah, I think this after giving this N-acetylcysteine, the levels will fall. This is what I know. Apart
Yeah,
from that, I don't know the other treatment.
yeah. Actually, we need to follow up with the like no liver function. Maybe later they can present sometimes with the abnormal liver functions. Okay, so we need to monitor that regularly. Then also the psychological, if like no, why she has taken
Oh,
paracetamol. That also to be like no, we have to address that and see what is the reason. Maybe we need to help her in supporting with the psychologist.
okay, doctor.
Okay. Yeah, so can I know even you may have more questions, so as there is not much time, so can I summarize for you? I can
Yes.
take up question in another meeting.
Yes, doctor, sure.
Yeah, so we discussed about the Hina who presented with the paracetamol poisoning, like how they present, what clinical features they have, how what investigation usually we do, and the treatment. Okay, and the involvement of the like no who specialist, like I told, psychologist, pediatrician, even like we can involve the hepatologist here.
Okay.
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 Yeah. So I will give you some trusted website, and I will tell you some books names so that you can go through it. What do you think about preparing about a seminar
Sure, doctor.
on this topic?
I will do it next week.
Okay, okay, that's good.
Okay.
That's great.
Time
Yeah.
finish actually. Okay.
Okay.
Okay, doctor. Thank you. How was it? I'm sorry, yeah. Because, but
The,
these questions were asked. That's why I asked you.
yes, yes, yes.
Okay. Any
What was the scenario, Dr. Fatima? I was not there. What was the scenario
problem.
exactly?
When we discuss, you will get to know about the scenario. It's
Yes.
paracetamol overdose. Explanation to the medical student. Okay.
I think a presentation was Alhamdulillah, she carried out very nicely and gracefully. The only thing is, if it comes as a shock, then all the pathophysiology, which we generally know now, I know she definitely must be knowing the NAPQ and the sulfhydryl and everything, doing working. But when it comes as a shock at that point of time, probably it becomes difficult to
Yeah, yeah. You
remember.
don't
That was
catch
the only
the
thing.
points. Yeah, yeah. You're right. This is what happened with
But
her.
she gracefully took the entire journey, which was very
But
nice.
in communication, it's okay. If you don't remember,
It's
you can
okay,
tell that I
absolutely.
will
We
go
are not
back.
pharmacologists and we are not over here this to understand. It's
Uh,
okay. But the thing is, yeah, if
yeah, but
like she
all
rightly said, Elvin.
yeah, but whatever questions I asked were the asked questions like the stages and also the toxic substance and what is the action of NAC. All these things
Hmm.
were asked. We'll just go through fast, no problem, as a revision so that we all can remember it, no problem.
Yeah.
But I think overall,
Yeah.
the regarding the communication, empathy, sympathy, I think it was good. You started with the previous knowledge and you are involving her. You are asking the questions, which is more important. And mainly she wanted this explanation of the normogram, which you gave. Only one question that about the toxic and the action of NAC. If you know that it's just one pathway which we should just see and remember in our mind. That's it. If we know that pathway, we can answer this question. But otherwise, your question of the stages of poisoning, even though you did not tell the stages, but you told the sequence. The sequence is nothing but the stages. Like first there will be GI presentation, then there will be a liver damage. The third will be liver failure. The final stage they will present with liver failure. These are what are the
Okay.
stages. But you told everything in your own way. It was correct. No problem. Only this thing. Okay. From my side, anyone wants to give comments? Please go ahead before we go to the discussion.
Yeah, it was good. She nicely carried out the scenario. The only thing was that, like I think the nanogram should have been come a bit earlier. And I mean, basically, the way to deal with any poisoning scenario is, first of all, you have to ask about the, although the scenario is going to be based on the questions of the role player, but like you have to ask the context of the poisoning. Like you have to take the history, like we have to know why she took the poisoning. This lethal dose of paracetamol, number one. And number two is if she was taking any other drugs as well. This is very important because some drugs like carbamazepine, they like increase the level of paracetamol. Number two. And number three, in the start, you have to inform the toxicology and you have to take their opinion as well. Okay. Drug control. This is very important in every sort of poisoning. Sometimes they give the scenario methotrexate toxicity as well. Okay. And last thing is, totally I forgot. You have to uh, we have to consult one person. I can't remember right now. I mean, two concerned departments
Toxicology,
you
you
have
mean?
to involve.
Toxicology center, you mean?
Yes, you have to inform them because they are the ones, they will guide you properly. There's a toxicology helpline as well, na? In UK, all over
All
UK.
hospitals, no,
You have to
even
call
in
them and you
general,
have to
all
call them.
hospitals will have this toxicology helpline. Yeah.
No, you just simply no need to tell them that you need to know a number or helpline, but you have to put this thing in the scenario like you have to involve the toxicology department. Okay. I mean, they should know. I
Okay.
will find out. I have written in my notes now those two words specifically. That is universal. Like in our
Yes.
country, we are also doing it. We have to inform them, and they are the people who properly guide us. Like right, and that was one
Yes.
thing. The context of the why the drug was taken, you have to take a proper history from the parents and involve the psychosocial services from the start. Okay. I mean, the reason for the suicide and all that stuff, and why she took the toxic level, and if she's taking any other drug as well. Okay. That
Yeah,
was
Yes,
these are
yes. What you're saying is correct. But in this case, if we go through, even I was not able to cover the treatment properly. So
no,
if
no,
you
you're
like,
quite
no,
right. I mean, you are quite right. You see, this is like, it's not your agenda, it's the agenda of the role player. You have to answer his or her questions. You're quite right. But you can add on like it, na? And but
So it
try
is,
to
all
bring
these
up the,
points, or just like when you get a role player asking these questions, you can go ahead like that.
in
yeah.
fact, Dr. Sridevi, like if we are getting 4 minutes, we can escape, we can make a format in our mind. Suppose this is a paracetamol, suppose unknown, some other drug, I don't know about it. I could have added like, general things. Like this is for me also, because sometimes we forget the things. So we can make things like we have to involve the toxicology department, and there are toxic substances which are produced. I will tell you, we will read like this, like you could have escaped that part involving the toxicology. She's telling very right. Like here also, if we have to inform to the toxicological department.
And you're, yeah,
So
and you're
yeah, yeah.
consultant as well, consultant or senior as well.
consultant, yes.
This
So
is
this
one thing.
is
And one more thing, Dr. Sridevi, you don't
Uh,
give charcoal if 1 hour has gone. Charcoal is only given if the poisoning has been there for at least less than for only 1 hour. After 1 hour, it doesn't work. Okay. And now the
Before
use
4 hours,
of,
we cannot give.
I don't think so. It's obsolete now, but I will check again.
Mm,
Maybe I'm wrong.
because once gastric empty, it passes the stomach, there is no role.
No, actually, for
No.
paracetamol, that's why 4 hours. The total for the complete absorption from stomach to this is 4 hours. That's why that
But,
window is kept. That you will take the levels only after 4 hours to know the exact levels in the blood. That is why at 4 hours it peaks, then it falls down.
yeah, I mean,
Because
charcoal only in first hour, not more than
Let's
that.
check.
yeah, first one.
Let's check
Usually,
it.
I mean, because charcoal, the role of charcoal is to absorb the poison from the stomach. And after
Stomach.
1 hour, the poison is absorbed. So there is no point of giving charcoal. And the risk of giving charcoal is aspiration as well. So that is like now the use of charcoal is getting obsolete now.
Mm.
Okay. Now let me tell the important points which Dr. Sridevi had forgotten. So whenever we take the just 1 or 2 charts, if we remember, that's more than enough for this. Whenever we take the paracetamol, 95% of it will conjugate with the glucuronides and the sulfates. Okay, so it is excreted in the urine. 5% of it will be formed. Just remember this product, NAPQI. Yes, to remember, NAPQI. Okay, this is the one which is toxic. Okay, normally what happens in the therapeutic doses which we give, it combines with glutathione, which the combination of this with glutathione will make it non-toxic and it will be excreted in the urine. But in case of paracetamol overdose, what happens is there will be reduced glutathione because too much of NAPQI is produced because of the overdose, and there is lack of the glutathione. That's why this product is accumulating, which will destroy the liver cells. This is more than enough explanation. What do you
Yeah.
say?
Okay.
Anyone wants to add anything?
Quite
Yeah,
right.
yeah. Now I remember about glutathione. Yeah, we should remember this.
Yeah, only this much is
Hmm.
enough for this scenario. This NAPQI and the glutathione. So what the N-acetylcysteine does? Let's go to one more.
Glutathione,
Yeah, one I have.
right?
Yeah, you're right. But I'll just share one picture for you. 1 minute. So you can see this picture. All of you can see the picture.
Yes, yes, yes,
Okay,
yes.
so what
Yes.
happens here? This is what normally this glucuronide and sulfate I told you, this is excreted, no problem. Now NAPQI, which is toxic accumulating, the N-acetylcysteine will provide glutathione. I don't know how it provides, but just you can tell that it will make a way for to provide the glutathione to combine it with NAPQI so that the non-toxic conjugates are formed and it is excreted. This is the
Yeah.
simple explanation for that.
Yeah.
Okay. So the only one word you forgot was these
Yeah.
two, NAPQI and glutathione. These two are important for this scenario.
You're
That's
quite right.
Yeah.
it's very, if you remember some two things, if you keep it in somewhere in the corner to go through before the exam, I think for this can come because paracetamol is the commonest poisoning.
Yes.
And the
Okay.
toxic level is 150 to 200. It's not 200, no?
Yeah, toxic
Ah,
level also I want to tell you, it is 150. Take it as 150.
yes.
And also you, even if it is 75 mg per kg and above, you should be alert that there can be something
Yes.
wrong. If
Yeah.
you want
It,
And
to start,
I rep-
one
so
more thing. One more thing I want to add, Dr. Sridevi. The thing is that there are two types of paracetamol. There are slow release tablets as well. And there is our word called as the staggered dose. Staggered dose is
Yeah.
like she did not take all the 14 tablets in one go. She started taking the tablets from like 6 or 7 or 8 hours. Like after every 1 hour or after 2 or 3 hours, she kept on taking two tablets, two tablets, two tablets. Now, so then at that time, when and you have a very clear history, the role player says the patient says like this is the way she was taking, you have to start an acetylcysteine immediately. You don't have to wait for the levels because like it's like going to go sky high.
yeah,
I mean,
but here, the scenario was just she took 14 tablets.
yeah, yeah.
So we can go according to the scenario.
Because in one of the questions the role player asked her was like for 4 hours we will not do anything, or I mean we can't. So in that way you have to answer, okay, there are only two possibilities in which you have to treat early, when either there is some other drug which might increase the level of paracetamol, then we have to act immediately, or we don't know how much time has elapsed, then you have to give benefit of the doubt to the patient. Otherwise, we start the treatment, but we send the levels at 4 hours.
Okay. Suppose if you don't know the quantity exactly, so you will start the treatment before, but you will send the levels at 4 hours.
if you don't remember, just remember most of the toxin, they are, I think, 10 times more than the usual dose. Suppose this is a paracetamol, 15 mg, usually 8 to 10 times more than the what we prescribe. 15 mg per kg we usually prescribe, so 150 mg per kg is the toxic dose.
Okay. So for the investigation,
Also, I think if the patient came late after 4 hours from injection, we can start it immediately.
yeah, this is what happened in the scenario. It was 7 hours. So it was started immediately and the levels were sent. Okay. 1 minute.
Yeah, yes, yes.
Just 1 minute. sorry, in the investigations along with liver functions, even I know that PT is a part of liver function, but still you can mention it as an important investigation because prothrombin time is an earlier and better indicator of liver damage. This, if this question is asked, why PT should be sent here, why, means PT is an important indicator of earlier liver damage. That's why. Okay.
Quite right. And
Yes,
this will
yes.
also
Question
decide
can be
if,
asked.
if the patient will go for, God forbid, a transplant or not. Because if a child who comes with the INR or PT INR of more than 2.3, you have to refer to the transplant center immediately because like the time has gone. So this is very important, a prognostic marker as well, PT INR.
The liver makes important factors of blood clotting. When liver becomes damaged, prothrombin time rises. The higher the level, the more severe the liver involvement. So it will be checked several times. So this is an indicator of the degree of the liver damage. Okay. So PT.
Yes,
That,
yes.
I don't think normally with LFTs, do we request PT?
No,
See,
it's a
doc, yes, yes,
baseline
yes.
done.
The
Normally,
thing is,
liver function test
yes,
No,
yes,
no,
yes.
normally, no, we should tell separately.
separately. Yes.
See,
What
here,
I-
Yeah,
here,
yeah.
why it is important? Because PT has very short half-life. The half-life of PT is very short. If liver is damaged, the reflection will come in PT-APTT. While for the longer duration, if you're looking for the liver illness, albumin will be the marker. So any acute illness, you have to see the PT-APTT.
Yeah. So here the in this investigations, this PT is important. I don't know whether you told this or not. I don't know.
Half-life, if you see, it is in hours, PT-APTT. If
And
it
as
get
you said,
damaged,
there can be damage to kidney also. So renal function tests is important. Liver function test, prothrombin time, renal function test, blood sugar levels, because low levels called hypoglycemia can occur when liver is failing. So in the stages of liver failure, also you can get the hypoglycemia. You can see low levels of blood sugar. Suppose if she asks why blood sugar to be tested, okay, then ABG is very important because this involves an arterial blood gas sample taking, okay, reveals the levels of acid in the blood. Acid levels are very tightly controlled by the body, and in paracetamol overdose, acid levels can rise early. These patients are probably to be sicker and some develop liver failure. So to know the ABG, blood sugar, renal function test, PT, never forget to tell PT, okay? If you, it will undermark you if you don't tell PT in this case. Then liver function tests, okay? We all know that paracetamol levels should be taken more than 4 hours, and this is what she was telling. The tablets have been taken over several hours or days. This is staggered overdose, okay? In one go also can be taken. So depending upon your case, you have to address, but it will be the same investigations. Okay. So how is paracetamol overdose treated? Immediate management will require resuscitation and stabilization. If the patient is unstable, such as low blood pressure, and there is overwhelming liver failure, they will need to be treated in ICU. So don't forget to tell the resuscitation and stabilization also, depending upon how sick the patient is, because sometimes these 14 tablets, 20 tablets, they are very, the dose is too high. Okay, paracetamol levels will be sent off once the result is back. This is compared with a standard graph. Patient who are above a certain line will need treatment. Those below the line may not require treatment. Treatment is with intravenous N-acetylcysteine and given to all who have high paracetamol levels. If there is any doubt about the time of overdose, there has been staggered overdose. Intravenous NAC is started without delay. All patients will need to be seen by psychiatric team before discharge. This you told. Okay, regarding this, we have to know this graph. I will share it now. And suppose if we start the N-acetylcysteine before also, once we get the graph and the levels are below the graph, we will stop the treatment, right?
Yes, yes.
Okay. And if the levels are on or above the line, we will continue the treatment. But I don't think we should know the dose levels and all those things. They will not ask, right? I don't know really. For this scenario, I think if we know this much is more than enough. And I will share the nomogram as the last, and next we will move to the next. Please.
You will repeat the paracetamol.
Go ahead.
After 18 hours, you will repeat the level again. It's
Not
written here.
18 hours. Where written?
I don't know. I have opened this up. It's the British guidelines. I can share the link, or I mean, if you allow me to screen share, I don't know how will it be. It's written quite clearly here. I can read it for you.
Share with me. Otherwise, just screenshot and share me the part you are telling. I will share here. No problem.
Okay. Yeah.
Dr. Noor, what was the question that role player said that I will get back to you?
The question was about the toxic product of the paracetamol poisoning. What is
Napki, okay.
which will affect, and one more question was what is the action of NAC? How it prevents how it helps
Okay.
paracetamol overdose? Yeah.
This scenario, educational scenario, one more question. A role player can be asked that why the neonate or infant have high tendency of paracetamol poisoning.
Because of the immature liver, you mean?
Yeah, but that is, you can say in the mother, but for a medical student, you have to give an answer that is medically explained, like they have this conjugation pathway. This
Maybe
conjugation pathway.
glutathione, there is no sufficient glutathione.
One is that, but the main pathway is sulfation. Sulfation pathway is the main pathway for small children like infants, and conjugation pathway starts after that period, like after 1 year or 2 years. So the sulfation pathway cannot metabolize paracetamol more quickly than the conjugation pathway can. So that is why that is a question. Actually, we have to only answer the question asked by the role player, because in educational scenario there is no chance of giving the knowledge. It is only just acknowledge.
Yeah.
Not knowledge, acknowledge. Yeah.
Okay.
I don't know, Dr. Noor, I can't find your name here. No. What is your group? I mean, I have so many groups. Or just give me a text me a message. I have shared this. I mean, guys, this go through it. This is UK guidelines for paracetamol poison. This is very nice.
Okay, I send the message to you now.
Yeah, okay, I will send you. Yeah, there it is. This is very nice, Dr. Noor. I would recommend everybody to go through it. I'm sharing the screenshot as well, where I read it now. This is the screenshot, the monitoring, okay? I mean, whenever I have to read this poisoning, like I read through this talk, this one which I am sharing. This is very nice, concise, precise, and detail is given as well.
Is this from UK or is this Australian?
UK,
This one is Australian.
UK.
Australia, I think.
This one Australia.
No.
Yes.
Let me see.
Melbourne.
This is RCPCH, Royal College Hospital, Melbourne. What is this? Ishaza.
No. This is Royal.
This is different.
Melbourne, not RCPCH. This one. Anyways, I don't know about the UK. We have to check for the UK. Okay. How often they are doing.
Anyway, I mean, this is basically a guideline. I mean, I find it very nice. I mean,
here it's given 18 hours, but I don't know. We will check from the any of the UK and find out. No problem. So now